So I have been a consultant for less time than Prash. So I've been in post here in Cardiff as a breast surgeon now for just over 2.5 years. So I am going to repeat quite a lot of what's been said by both Prash and Nick Markham, who was one of my trainers. So what kind of trainer do you want to be? And I think you are a trainer now. You're a registrar, you teach the SHOs, you teach the medical students, you teach the junior doctors. And that's not just in surgery, in theatre, that's on the wards, that's in clinic. And I think this is one of my favourite quotes of all time. It's that lots of people will forget what you've said, they'll forget what you did, but if you've made them feel bad, they'll remember that. So really you want to be making them feel good about themselves. So what kind of trainer are you now? Are you a good trainer as a trainee? And how do you know that? Are you sure? So do you have a network of people around you in a similar sort of area, or perhaps anaesthetists or people who see how you are at work? And are they honest with you? So, would a nurse tell you if you were being a bit harsh with an F1? Or am I, as the surgical tutor, getting phone calls from people going, I'm finding it really difficult to deal with this particular registrar, have you got any advice? Because I do get those phone calls. Never expect someone to learn if you're scaring them. It's physiologically impossible. If you are having fight or flight just to be staying in the same room because somebody is that intimidating, they're not going to remember anything of what you say. So everyone in this room, if I made you picture them, could picture their worst trainer. And they can also usually tell you who their best trainer was. So are you either of those people? And the worst trainers, it's often about lack of control. So if they are worried about something, that sometimes comes across as, you're doing a rubbish job, I don't trust what you're telling me. And I think it's really important to trust your trainees as well. And actually, if you can say at the beginning, I don't like not being in control of this situation, I need you to ring me after 20 minutes in this operation if it's not going well, or I want to know what's going on the on-call, then actually they're much more willing to forgive you if you have an off day, and everyone has an off day. So be the role model you wish you'd had. And if you're not good at training, recognise that. So you can go on course, you can get mentoring, and there's lots of professional support available from your health board and from the deanery. Work with your colleagues, so give your trainees a good, fair distribution of opportunities within the department. If you're somebody who thinks in the beginning, I would like to establish myself as a consultant, I don't want to let the ST7 do all my operating, well, do you know what, that's okay, but at least recognise that at the beginning and make sure that you share out the opportunities available within your department. So agree what the trainee can do or the opportunities that there might be at the beginning of that list, or perhaps even in a clinic, and set boundaries. And it's okay to want to do things yourself. I think much like saying no, that's something we find that quite difficult. So negative feedback. So no one enjoys getting negative feedback. So have some nice things to say as well, because everybody's got something nice you can say about them. And if things aren't so good, be specific. So what isn't good, and what can they do, and why is it not good, and what impact is that having, particularly on the patient? And ask yourself if now is really a good time to let that person know what you feel, and it's never after a night shift. So I always think, if you can say, would my mum be proud if she'd seen me say that to that trainee, and your mum would be okay with it, then that's probably as good a guidance as any. So using your time well, and lots of people have talked on this, so I think at work you're going to have lots of things that pile up, and you have to try and keep on top of it. So prioritise, and then prioritise your priorities. And some people have different priorities at different times of the day, and you have to work out what your own flexibility is. So what matters is really the output, or patient care. It's not how much time you spent putting into it. So what you've got to do is really pick the things that make the most impact to help you achieve what you want to achieve. So use that in your home life as well. Do you really need to spend 2 hours going around Tesco's every week? Get it delivered, get a cleaner. Buy yourself time. If you've got a partner, pencil into both your diaries a date night and make that your priority. And I think what's really important is that your priorities might be different to your colleagues. So my priority when it's summer is to go running with my running group, which starts at 6:30. So that is my priority. I am out the door and I am at running by 6:30. But other people's priorities might be to get home and bath their kids. And that's fine. Everyone has different priorities, but you need to know what makes other people tick. And I think the biggest thing you can do is to really, before you get upset about it, think, will this actually matter in 6 months' time, in a year, in 5 years? And if the answer's no, then you have to let it go. A bit like Elsa in Frozen. So, justify your actions. Don't compromise on your family, your friends, or your integrity. Finding it challenging is not a reflection of weakness, and it's certainly not a reflection of inefficiency. Sometimes it is just difficult. People do some strange things for good internal reasons, and that can be colleagues, that can be trainees, and that can certainly be patients. They might have thought it was a really good idea to put a needle into their breast reconstruction 4 months down the line for no good reason, but in their head that was a good idea. So if you can justify, If you can justify to yourself why you did something, great. But if you can't justify it to yourself, don't put yourself in a position where you're having to justify it to other people. Ask for help. I know we've all said this, but get to know your colleagues not just on a work basis. What makes them tick? And also, are they, needing your help? And do you need to be looking out for them too? Operate together as consultants, and I think that's becoming more common, which is a really nice thing to do because you never get to do that as a trainee. Very rarely operate with somebody who's on a similar skill level to you. So it's really nice. And own up to being concerned about procedure. If you haven't done one for a while, just say, I haven't done one of these for a while. What do you think? And don't be afraid of asking for help. As a new consultant on call, there is always somebody you can call, and you usually work out very quickly who you should call. And they've never said no yet. So complaints and governance, really, you've just gone over this, but keep records and be organised. If you feel a consultation isn't going well, then stop and excuse yourself. Just leave the room for 5 minutes, have a think, just get someone to go in, make the patient a cup of tea, and then go back. Nurses are really good witnesses. So our clinic sheet, we've got the name of the chaperone. There's a box for that, so it prompts you to write it down. So I think that's something that's definitely recommended. And if you feel it hasn't gone well, reflect on it and get the nurse to reflect on it at the end of the clinic and write down why you felt it didn't go well. I think insist on a second opinion. It's okay to go back into the room and go, I don't feel like we're getting anywhere, but can I ask my colleague to see you? Know your colleagues, know your figures and data, and that's as an individual as well as a unit. And use your defence organisation. I think that's really important, especially if you're appearing in coroner's court. It can be a really scary thing to be stood there, but actually you can get really good advice before you get to that stage, and they will help you rewrite your statement so it's got less woolliness about it. So keep yourself well. Exercise, you need to find something that you really like doing, and exercise improves your mental health as well as your physical health. And I think as doctors we need to be saying that to our patients, but unless you're doing it yourself, you're kind of not treating yourself first. Eat well. Don't get home from a really long day in theatre and think, I haven't got anything in the fridge. Just be prepared, and it's about being organised. And most importantly, and James will laugh because he thinks I'm always on holiday, is that use your annual leave and do something with it. And that might be different for different people, but again, I don't get any more annual leave than anyone else, but make sure that you use your annual leave. And then a little bit about image. The transition, if you are a trainee to a consultant, can sometimes be quite difficult if you've worked in the hospital before. So agree titles with staff. If they've called you as a registrar and they've called you by your first name, that's fine. But if you want them to call you Mr. Jones, Miss Egbeare in front of patients, then tell them, because they don't know that. And if you want them to call you Donna, do what you're comfortable with, not in front of patients, that's fine too. I think for women in particular, it's quite difficult sometimes to come across as, especially if you're a small female, it's sometimes really difficult. Patients will go on a ward round and they'll speak to your F1 because he's a man and he's 6 foot tall. And I had a military F1 as my first consultant job, and everyone 100% spoke to the F1 and he would go, she's the boss. But it is one of those things, and it's whether you want to come across as somebody who knows what they're doing and is professional. And all I would say is, an image consultant can sometimes be a good thing. And that's not just for women. I think men could go and see an image consultant too, but you do have the advantage of just being able to put on a suit. So be kind to people, be approachable, and that's through a variety of methods. So I would say I get emails, but I also know that my secretary gets phone calls, and she will give them my mobile phone number if it's a trainee and they want to talk to me. I think be approachable. And don't forget, the trainees also are other things. So they are a surgeon and, maybe they're a runner, maybe they are a mother of 4. Maybe they are somebody who won a photography competition and would like to go and, do more of that. Maybe they travel, maybe they volunteer. So find out a bit about your trainees and listen. And then finally, a plea. Fill in workplace-based assessments and try and make them useful. You know how frustrating it is if you send off 1 million workplace-based assessments and nobody fills it in. So just think of what it felt like to be in their position when you're in your position. So my final top tips, and I have a different 3 A's to Mr. Markham. Mine are be able, so do your job. Be affable to your colleagues and to your trainees and to the multidisciplinary team around you, and be available. Have a work life and a home life, and there are some things you have to just stop worrying about. You can't control everything. Get a good secretary. I think we've all said that. It's massively important. And be organised. I think one of the things I would say I've learnt when I think was a second year registrar was a colorectal surgeon said to me, after every operation, ring that patient's relative and tell them that you're going to ring. And actually, having been on the other end of that as the relative, it's really nice when someone phones you and says, actually, it all went fine. And even they're only saying it all went fine because that's what you say, actually, it's still reassuring. Find a mentor and have a network. So, it doesn't have to be local to you. You can ring somebody in Australia. Just sort of say, oh, I've got this case, this is, what do you think? And have somebody to bounce stuff off and take your leave. So, thanks.